Hello guys, welcome back to my YouTube channel. Today we'll discuss about COVID-19. COVID-19 is an infectious disease caused by a virus called coronavirus. Now in this slide we'll discuss about pathophysiology of COVID-19. So once the COVID virus enters to our bodies, mainly attack the heart, lungs and our blood vessels, and it leads to the respiratory and circulatory disturbance and sometimes failure, and it results in hypoxia. Here hypoxia means an absence of enough oxygen in the tissue, and it results in again in two ways, that is cell death, and other way we have ASIF 1 alpha stabilization. So from the cell death, again it will increase our damage associated molecular pattern production, and it will result in again ASIF1 alpha transcription increase. Means this transcription factor plays an important role in the cellular response to systematic oxygen level, and it results in cytokines production. Cytokines are small protein important in cell signaling, and at last it will produce macrophages increase. So here macrophages is a type of white blood cells that surround and kill microorganisms and remove dead cells and stimulate the actions of other immune system cell, and at last it leads to COVID-19. Again this hypoxia may result in ASIF1 alpha stabilization. This ASIF1 alpha is an hypoxia inducible factor, and it leads to B increase of our VEGF integrins, means vascular endothelial growth factor. It is a signaling protein that promotes the growth of the new blood vessels, and it leads to vascular permeability, means this characterizes the capacity of our blood vessels wall to allow for the flow of small molecules or even whole cell in and out of the vessel, and it helps in release our neutrophils. It is a type of white blood cell that is an important part of the immune system and helps the body to fight the infection, and at last it leads to ARDS and pneumonia. ARDS means acute respiratory distress, and pneumonia means infections that inflames our air sac in the one or both lungs, which may fill with fluid. Here again all reasons will lead to hypoxia. Now in this slide we'll discuss about the classification symptoms were categorized as follows. First we have mild case, second we have severe case, and third we have critical cases. In the mild case include all the patients without pneumonia or case of mild pneumonia, and in the severe case we have patients with difficulty in breathing and low blood oxygen level and lungs infiltrate, and in the third, it is critical cases, we have patients with a respiratory failure, septic shock and multiple organs dysfunctions and failure. Now we'll discuss the symptoms of COVID-19. The most common symptoms include fever, cough, tiredness, loss of taste and smell, and less common symptoms include sore throat, headache, ache and pain, diarrhea, and rash on the skin and discoloration of fingers. Here diagnostic method, how we can diagnose this COVID-19 by the laboratory test, that is RT-PCR testing and CT scan and rapid antigen test. By the method we can diagnose the patient with COVID-19. Now here we'll discuss about the how to be safe at home and safer methods at home. First, leave home only for essential work and necessities. Second point, we have practice good hygiene. Third, we have work remotely whenever possible, and fourth, we have physical distancing and use cloth face covering when you are in public, and last we have disinfect frequently. Here we'll discuss about the prevention of spread of the COVID-19. At first we have maintain a safe distance from others, at least 1 meter distance should be there. Wear a mask in public and choose open, well ventilated space should be choose, and clean your hands often, and get vaccinated when it is your turn, and cover your nose mouth with your bent elbow or tissue when you cough or sneeze, and stay home if you feel unwell. Here in this slide we will discuss about questions and answer. Can people with the mild COVID-19 symptoms recover at home? Yes, people with mild symptoms who are otherwise healthy should manage their symptoms at home On average, it takes 5 to 6 days from when someone is infected with the virus for symptoms to show. However, it can take up to 14 days. And what are the organs most affected by the COVID-19? The lungs are the organs most affected by the COVID-19. Here we'll discuss about complications of COVID-19. First we have pneumonia, next we have viral sepsis. Here sepsis means that infections in our bloodstream, and acute respiratory distress syndrome, and kidney failure, cytokine release syndrome, and respiratory failure, pulmonary fibrosis. This pulmonary fibrosis means it is a lungs disease occur when lungs tissue becomes damaged, and pediatric multisystem inflammatory syndrome. These are the some complications which is very common with the patients of COVID-19. So thank you for watching.